Everyone, and welcome. My name is Jen Richards, and I'm excited to be discussing our new Opioid Stewardship Designation program. With me today, I have two very experienced reviewers. Thank you, Mark and Diane, for joining me and sharing some of your insights into how this program can benefit patient care. When we started out, our goal was to create a program that allows organizations to develop strategies, interventions, and/or treatments that will promote patient-appropriate access and use of opioid medications. Diane and Mark were instrumental in helping us consider these programs within the different sectors of healthcare based on their review experience. Mark, I wanted to start by asking what areas of the industry you can see excelling at opioid stewardship.
Well, as a pharmacy reviewer, I can see a perfect alignment with the pharmacy programs, mail service, specialty, PBM, because those organizations deal with this opioid situation on a face-to-face basis. But lots of other programs within our clinical program structure, care management, could also integrate the designation into their programs to be able to demonstrate exceptional patient care within their patient networks.
Awesome. That's great. Thank you, Mark. So this program was designed to allow organizations flexibility in what the program itself looks like, while utilizing a framework of designing and implementing strategies, interventions, and/or treatments, and then requiring remeasurement. Diane, you have been with URAC for 8 years. In your experience, what are some of the ways organizations may already be taking steps to promote appropriate opioid medication use within this framework?
Thank you, Jen. One area that organizations typically already have in place are quality improvement projects. So quality improvement projects address opportunities for error reduction or performance improvement. And for a quality improvement project, there are typically several central elements that need to be included. So one would be to establish measurable goals for quality improvement, to design and implement strategies to improve performance, to establish the projected timeframes for meeting those goals. And then you're always going to be including remeasurement, that should be at least annually, and documenting changes or improvements to the baseline measurement. And at the end, you always want to conduct an analysis if the performance goals are not met.
Those are great principles to quality measurement and improvement. Do you have some examples of quality improvement projects that may help organizations demonstrate opioid stewardship?
Yes, organizations may want to improve their methods of identifying potentially at-risk members in their population for this designation. Also, possibly developing patient education or resources that they don't have in place and they see a gap. And maybe finally in the area of staff, perhaps they don't have appropriate resources for their staff to assess these patients. And the potential for bringing these patients into care.
These are all great ideas, Diane. Thank you for sharing. As we wrap up, I wanted to ask just one more question to each of you. So Mark and Diane, what makes you excited about this program?
Well, within all of the programs at URAC, the focus is exceptional patient care. And this is just another example of how organizations can demonstrate that exceptional care within a specific population.
And I think I would add to that the flexibility of this program and also the simplicity. There are 4 standards, and this is a program that, as Mark said, is very applicable to many different types of accreditations and certifications. And it's also flexible and simple enough that it would be easy to incorporate into already existing accreditations as a designation.
Awesome. Thank you so much, Mark and Diane, for sharing and for spending some time with me today as we discuss this opioid stewardship designation. For additional information, please visit our website at urac.org. Thank you, everybody.